The city of San Angelo has gone through many changes since the first reported coronavirus cases back in March. With the recent surge the past month, the Public Information Office increased their reporting skills.
When we first started putting information out about the pandemic, it was just a few lines of total tests, positives, negatives, and that was about it. And now we are listing case information, we're listing demographics, we're listing a great deal of information.
With new updates administered by the FDA, the San Angelo Health Department has a more in-depth analysis of how the COVID-19 testing is conducted. This information is then passed on to the Public Information Office.
So there are three different kinds of tests. There's a PCR test, an antigen test, and then an antibody test. And the antibody test tests for past infections, not current infections. So the PCR and the antigens, we recognize both those when it comes to positives because both of them are confirmed positives by the FDA.
The amount of information that is received differentiates on the weekdays compared to weekends.
Friday, we get a great deal more of information from our health department. We get the total tests, we get how many people are in the hospital, how many people are in the ICU. We get the negative total for the week. We get a positivity rate.
The most important aspect when reporting coronavirus cases is making sure all the information is correct. This can be challenging at times.
We want to be accurate, and that's definitely one of the things is that it takes time to make sure. We're a two-person office, and so we double check each other every time, and we're making sure that we have the right amount of tests, we have the right amount of people that are listed, because we want to get it right the first time. We don't want to have to issue a clarification or a correction or anything like that.
Mark Brown, KSAN News.